I decided to do my health education project on taking care of the geriatric population. The geriatric population is a group of individuals that I've always been very fond of caring for. It started from a young age taking care of my great grandmother. She was my best friend, someone I looked up to, and I always found great reward in helping her in any way I could. Then I decided to move on to a job working for a home care company where I would go into seniors' homes and take care of them, bathe them, feed them, just help them with their daily chores that they couldn't do anymore. And it was always just something that really made me happy. So that eventually led me into my career path of nursing, which is why I chose it. So I decided to do my video on something that I felt really passionate about. So let's start by talking about the physiological changes that happen with aging. It's a natural process that everyone goes through. And then with this natural process, different diseases or illnesses or just different life phases can occur during this. So first we'll talk about the integumentary system, which is also known as your skin. With aging, you lose the pigment of your skin, of your hair, which is why it turns gray or sometimes even white. This also causes wrinkling in the face and hands, easy bruising and tearing of the skin, which is why you may see elderly people with bruises on their arms. Even just whacking into a door can really, cause this to happen. Also, increased nail thickness, but decreased length. So sometimes you'll see on elderly people's toes, they'll have really thick toenails that are hard for them to manage, especially because they have a hard time bending down to be able to get to their toes. So that's why we always really like to recommend podiatrists to elderly patients. As well as their skin can become dry, itchy, and scaly, which is why, cleaning and moisturizing is always a really good idea. Next, we'll move on to the neurological system. The changes that come from this are slowed reaction time, slowed reflexes, loss of balance, which can lead to falls. They wake a lot during the night, either to go to the bathroom or just because their circadian rhythm is messed up. And also a decreased temperature control, which can cause them to become really cold, which is why you always, make the joke about old people being cold, that they wear a lot of layers and then they have their heat on really high in their house. But it's because their body can't control their temperature like it used to. Next, we'll move on to the musculoskeletal system. This changing in age contributes to decreased muscle mass. Their gait changes, so it becomes really short and wide, kind of like a penguin. And a decrease in height, a lot of times you see that hunched, rounded back that occurs. Also can be caused from osteoporosis in women. And then because of the neurological and musculoskeletal changes, a lot of times this increased fall risk for elderly patients, which is something that we have to be really mindful of. Having a safe environment, as well as maybe providing them with a walker or cane to provide stability, increasing the lighting in the house, and also just clearing any clutter or loose rugs that could become a tripping hazard. Next, we have the cardiovascular system. Because of these changes, they tend to have less energy, which is why you may see them napping during the day or going to bed earlier, as well as a decreased resting heart rate while they're sitting. And then they may have weak pulses, which will be hard to feel when you're assessing them, as well as increased blood pressure, but this can also lead to hypotension. So when they stand up, their blood pressure drops, hypotension, and it could cause them to become weak, dizzy, and even fall or pass out. So that's why we always tell older patients, sit on the edge of the bed, then we'll have you stand up, make sure you're not dizzy or lightheaded. Next, we have the respiratory system. They have a decreased lung function just because of, wear and tear, and also our organs, our muscles aren't functioning as well as they used to. They have a decreased size and number of alveoli, which are these little sacs in your lungs that help with the gas exchange. So when they're, decreased and there's not as many of them, it's harder for them to breathe, which is why they may become short of breath. As well as decreased depth of respiration, so while you're assessing them, their chest rise and fall might not be as great as someone of younger age. Finally, we have special senses, which are your eyes, your ears, tasting. So they have decreased peripheral vision, which we know is the sides, so they may not see as clearly, as well as cataract formation, so they're unable to see as well as they used to be. Possible hearing loss. Hearing loss isn't a natural thing that happens with aging, but it can happen from, life and things that go on, as well as a decreased sense of smell and taste, which is why elderly patients tend to like to eat ice cream and sweets, and things don't taste as good as they used to be because taste buds, they wear off and they change as you age. They also have a decreased pain awareness, or they may not be as verbal of their pain. It's just something that comes with life experience. So while taking care of a patient or a loved one, it's important to be able to read their body language, their facial expressions, just to be able to tell how they're actually feeling, because they may not want to verbalize it. Normally, this is at risk of them feeling like they're going to be a nuisance, so they try to keep it in, but it's important to assess them. Another change that happens with age can be mental health. Depression is a big one. As you go older, you become more dependent on your family or maybe a caregiver or a nursing home, so you lose your independence. A lot of times they have to stop driving, they can't go grocery shopping, so not being able to do those things for yourself can make you depressed. As well as grief, either lost loved one, spouse, child, pet, as well as grief from losing things you used to be able to do. And another part that goes along with the depression is isolation. They may have to leave their house, they may have to move into a nursing home, they may have to have a caregiver live with them, and just all of this tied together, it can make it pretty challenging. So now I want to talk about delirium, depression, and I forget, but we'll get to it. So delirium is sudden, it fluctuates. It could last a couple hours, a couple minutes, or even a couple weeks. Delirium, normally speech becomes incoherent, as well as their affect may look disturbed or frightened. An example I can give of this is being in the hospital for many days in an unfamiliar setting. The older patient may become confused, which could lead to delirium. Delirium differs from depression. Depression is normally recent due to life changes. It can be fairly stable. You'll see the fluctuation in the mood, and then when talking to a patient who has depression, they may not want to answer questions. They may say things such as, I don't know, or I'm not sure. They'll have a very flat affect, and their speech will be very slow. So now delirium and depression differs from dementia, which is gradual but with harmful effects as it becomes worse. Dementia can be seen as sundowning, so when the sun goes down, normally this can affect the mood and the behavior of the patient, as well as can make them agitated because they're just not in the right mindset. The brain isn't working the way that it's supposed to. The orientation of themselves is often impaired. Asking them questions like, what's your name, where are you? They may be able to say their name, but they might not know where they are, what time it is, or what the year is. With dementia, they may make up answers, or they may say things that don't really make sense, and they may have a hard time finding words that they would have normally used. Their vocabulary becomes decreased, and they also will have a slow and kind of blank affect. Now I'd like to move into elderly abuse, which is a big concern because they seem to be the forgotten population, which is why I find them so near and dear to my heart, to be able to, make sure that they get the proper care that they deserve. They lived a life, They most likely took care of people before, and now they deserve to be taken care of. So abuse can be a form of neglect by family or staff, either leaving them in their soiled underwear, or maybe not bathing them, washing them, or just ignoring their needs in general. Abuse can also happen by caregiver stress. I'm not gonna lie, it's not easy to take care of an older person, especially if they're confused or maybe even difficult. So it can be stressful when you have to take care of someone as if they were a child. And then also, self-neglect is also another form of abuse. Older patients aren't able to move around as well. They may not be able to shower or take a bath as regularly, or, as I said before, take care of their toenails or hair. So a story really sticks out to me while working in the hospital as a technical partner. I had a patient come in, and her legs, I'm not kidding you, they looked like lizards, like they were scaly, like falling off, and it was really sad. Her toenails were so long, and so every day I took care of her. I went in there, I would wash her legs with soap and water, I would lotion them up, and it was insane, the transformation that happened while taking care of her. Next, I'd like to talk about some common disorders that are seen among the elderly population. Arthritis, kidney and bladder issues. They may have because of the muscle, they're not able to hold their urine as long, or they may have accidents or become incontinent, as well as dementia that we talked about. Parkinson's disease it's horrible, but some of the people that I've taken care of are just so remarkable. The way that they persist. I had a patient that I used to take care of. I would go to his house when I was his caregiver, and he just never gave up. Every day we would go on a walk, we would exercise. He was very rigid about taking his medications, and he was young. He was only about 74, and he was not ready to give up. And with the work of the exercise and the medication, it was almost like he didn't have it. As well as glaucoma, which is your eyes, and cataracts too. Osteoporosis happens with the hunchback and the brittle bones. Alzheimer's disease, which is under the umbrella of dementia. It's a specific mind-altering disease that happens. And macular degeneration, which is when you get that cloudy black spot in your eye. It can be really scary. My great-grandmother had that, and she would try and read something, and there'd just be this big black blob in the middle of her eyesight, and it's really hard to do things when your vision is impaired. As well as depression that we talked about, and cardiovascular diseases that occur because the heart muscles just aren't as strong as they used to be. So here's some communication tips that I found online and things that I just use daily as working with these patients. You have to have the right body language. You can't be sitting there with your arms crossed and all shriveled up. You want to sit tall with your feet on the ground, making eye contact, having that open posture. Another thing that's really important is patience. They may speak slower, think slower, act slower, and you just have to really take the time to allow them to express themselves, because it may be different than the way you and I do. Respect is a huge thing. Understanding the age gap that may come. They may be like, oh, these kids these days, blah blah blah, but you have to respect their life experience and what they've gone through. Active listening is important. Something that we learn in nursing is silence is important to be able to allow them to get their point across. You want to build rapport with your patient. You want them to feel comfortable and open to talk to you about things that may be difficult. Show sincerity and concern for their problems. And then also to just use plain language, nothing too fancy. You want to make sure that you're able to communicate with them in a way that's appropriate. And lastly, empathy for whatever they may be going through, for family members, loved ones, or just their feelings in general. This goes for obviously talking to anyone, but especially with the elderly population, I find it's really important to be empathetic. Next, I'd like to talk about how to provide care. The patient that you may be working with may have a hearing loss, so you may have to yell at them, I know a lot of times in the hospital, I can hear nurses or other coworkers in the rooms talking to their patients, and they're yelling, but it's the only way that you can really, have them be able to hear you. Understanding their diagnoses and how it may be scary or new, or how to work with that. The generational differences, which I mentioned, and then just the age respect. I'd like to watch these 2 videos. The first one is about how to deal with elderly patients who may have hallucinations during the night, during the day, how to cope with that. And then the next one I'd like for us to watch is about how to help a person with Alzheimer's take a bath. It can be really difficult. I know that I had to help a patient once to take a bath weekly, and it was always such a struggle. But you have to make it fun, you have to make it light, to really help them to be clean and stay safe and healthy.
My mother's been waking up in the middle of the night and seeing things in a room that aren't actually there. We're both exhausted during the day because we're not getting enough sleep at night. Good night, Mom.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Mom, please. There's nobody here. No one's here. Go back to bed. Come on. Look, there's nobody here. All right? Go back to bed. We've got a big day tomorrow. Come on. Good night, Mom.
A person with dementia may experience hallucinations when the disease affects the regions of the brain that are responsible for interpreting sights and sounds. Hallucinations commonly involve seeing or hearing things that aren't there. They can transform ordinary, everyday experiences into frightening episodes. A good approach to reducing hallucinations is to identify and eliminate the objects or things that trigger them.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Oh, really? Let me take care of it. It's okay. Oh, I see. Okay, come on. Come on, I'll take care of it. Now you stay out here. Now he's gone, okay? I'll sit with you until you go to sleep, okay?
Okay.
You know, Mom, I think we should keep your coat rack outside so you have a place to keep your jackets when you come in.
Oh, okay, dear.
Okay? Okay. Good night.
Remember, patients experiencing hallucinations are having a difficult time interpreting their surroundings. Remain calm, reassuring, and try to identify what may be triggering the hallucinations. If hallucinations persist after trying to eliminate them, be sure to discuss this with their doctor.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me
It's been
alone.
a
Don't
week.
touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. Oh, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back. I'll pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional...
So now, Jared, thank you for helping me with this project. I'd like to ask you some questions, if you don't mind.
Oh, I'd love to.
Okay, so the first one. Which of these is a common physiological change seen in the integumentary system? So, increased skin elasticity. B, loss of hair pigment. C, increased blood pressure. And D, depression.
B, final answer.
B is correct. Good job. So if you know the integumentary system is your skin, your hair, your nails. So that would be the loss of hair pigment, which causes it to turn gray. Depression can be seen as a physiological change, but it has nothing to do with the integumentary system, which is why it's not the correct answer. So B, loss of hair pigment. Good job.
Oh, thanks.
All right, you got 1 point. Okay, 2. Mrs. Jones has been in the hospital for 4 days. She has never been away from her husband for more than a couple hours. Mrs. Jones begins to act confused, her speech is incoherent, and so what do you think's happening to her? A, she has dementia. B, she is depressed. Or C, she is delirious.
C.
Wow, 2 for 2. So being delirious can happen while in the hospital. Being away from your environment, your loved ones, your surroundings can cause not only elderly people, but anyone to become delirious when you're out of your natural environment. So our third question. When working with an older client, which of these techniques are best to use when communicating? A, yell while speaking to them. B, sit with your arms crossed. C, practice active listening. Or D, make sure the room is dark so it doesn't hurt their eyes.
C.
3 for 3! C is correct. When speaking to an elderly person, or anyone of that matter, you want to make sure that you're actively listening to what they have to say. Alright, number 4. Which of these is a commonly elderly disorder? A, cancer. B, macular degeneration. C, scarlet fever. Or D, chickenpox.
B.
4 for 4, look at you. Macular degeneration does happen as your eyes begin to change, and that's when you'll see that black spot. Alright, our last question that we have. True or false? It is normal for the body to change with age.
That is sadly true.
That is sadly true. As you age, your body begins to change, and it's just a part of life. Here are my references. Do you have any questions for me?
When you're taking care of people in the hospital or when you would go to their homes, do a lot of them have a lot of these symptoms you've been talking about here today?
Yeah, they do. Working with the elderly population, we see all these kinds of changes that I talked about. So that's why I really wanted to talk about it today, so we can recognize it and respect it, and ultimately know what'll happen to us as we grow older. Any final questions for me?
How do you think all of this, like helping them and knowing all this stuff about the older generation and all that, how do you think that's going to help your career as a nurse?
Well, as a nurse, I hope to one day become a geriatric nurse practitioner. It's a specialty that has always been really intriguing to me. And overall, I just think my care, my ability to make connections, and overall just my love for helping them will really benefit me in the long run. I'll be able to use everything I've learned from working with patients in the hospital, and then I'll be able to deliver that while working, hopefully one day, as a geriatric nurse practitioner. Thank you so much for sitting through this. I hope you learned something.
I learned so much.
Okay, thank you.